Red light therapy is more than just skincare. To me, it's part of my healthcare. It's a healthcare stack.
And then I started seeing the mask and stuff. It's like it got red light, blue light, and then you could do both at the same time. So I was like, oh, snap.
Red light therapy every day is just going to really help with all those dark spots, aging spots.
I feel like it's hard to live in this day and age and not have heard about red light therapy.
Maybe the glow of a red light therapy mask caught your eye while scrolling social media, or you saw a targeted ad for a red light helmet promising to reverse hair loss. Using light to influence the body's biology, a practice known as photobiomodulation, has become one of the fastest growing trends in health and wellness. Today, you'll find red light therapy everywhere, from medical clinics to gyms to at-home devices promising professional-grade results. Some, like content creator Rosa Hoffman, say it smooths wrinkles, fades acne, eases joint pain, and reduces inflammation.
When I'm not using red light therapy, the first thing I notice is my hands. My hands start to feel that inflammation right away, and I will immediately go and sit in front of my red light therapy.
And online influencers like Sly Huncho were drawn in by the made-for-TikTok glow and promises of this latest self-help tool.
I definitely love the mask. I just seen it on social media. I'm like, what is the benefits of this? Because I'm really a self-care type of guy. So I'm like, anything that helps, I'm going to try it.
Others, like Mika Stambaugh, who was diagnosed with melanoma and had multiple facial surgeries to remove the skin cancer, claim it boosts collagen and speeds wound healing.
All I really cared about was minimizing what my face was going to look like post-surgeries. I would pretty much try anything that anyone with any dermatology background has to offer. I would do it.
Thankfully, we have someone with a dermatology background to set the record straight about red light therapy. Dr. Margareta Masse, whose areas of specialty include general dermatology, cosmetics, and surgical dermatology. She brings the evidence.
There are some cool studies that actually take people and expose half of their face to red light and then don't do anything to the other half of the face.
Welcome back to Health vs. Hype with the American Medical Association. I'm your host, Trace Dominguez. Red light therapy has gone from dermatology offices to at-home masks, helmets, and panels that promise professional results from your living room. But how much of that is actually backed by science? And where does the evidence stop and the internet hype begin? On this episode of Health vs. Hype, we're bringing the facts about red light therapy into the spotlight. Join me as we find out whether red light therapy is all health or just hype. Okay, before we get too far ahead of ourselves, let's first understand what red light is in this context. Or for that matter, what light is. No big deal, not a huge subject at all. Simply put, light is a form of energy. Different types of light have different wavelengths, which is the physical distance between the peak of one light wave and the peak of the next. This is important here because the wavelength of light determines its color. We can see some light, like the colors of the rainbow, visible light, while other types like ultraviolet and infrared are not visible to the human eye. In fact, red light sits just on the border of the spectrum of visible to invisible light, and just beyond those red wavelengths, you'd find infrared light. Keeping this basic science lesson in mind, red light therapy uses specific wavelengths of red and near-infrared light that researchers believe can interact with our cells. Some of those researchers are from places like NASA. Red light therapy has its roots in space research. NASA first studied how specific wavelengths of light could help plants grow during space missions, and then explored whether the same technology could promote wound healing in astronauts. And that's just the beginning of how red light therapy made the leap to skincare and the wider health and wellness communities. We've seen over and over in the wellness community a willingness to try something, especially if that something doesn't seem to carry too many risks. So I was curious how our guests first found out about the red light therapy. Here's Sly Huncho.
So the first time that I tried it was in LA. I went to like this luxury spa and it had like different red light therapy, I believe in a sauna, and it was like this little roller thing that you can like sit on and it like massage your body and stuff like that. So that was when I was first introduced to it. And then I started seeing it more and more on social media. So I started doing more research and stuff, looking it up, the benefits of it, just because, first off, it caught my attention. If you put it in videos, it's going to catch people's attention. So I'm like, what is this? What's the benefits? And then I started seeing the mask and stuff. So I was like, let me try this. And it really helps me detox and really recharge. It's a good way for me to just like vibe out.
Rosa Hoffman had some reservations before trying red light therapy because not all commercial devices are created equally.
I had seen some articles and some news about companies that were creating these red light masks that were not actual red light bulbs. They were made with just these random LED bulbs that had no red light or near infrared, and they were actually causing more damage. And so that's why it becomes so important where you buy your red light. So I was a bit hesitant only because I wanted to make sure I was getting red light. I wanted to make sure that I wasn't just buying something that was not going to actually give me benefits. I didn't want anything that was just like surface level and wasn't penetrating. But did I have any reservations on, am I going to turn into a lizard person in 12 years from now? No, I wasn't really quite worried about that.
Okay, I want to jump right into the science behind red light therapy. And our expert today, again, is Dr. Margareta Masse. And in addition to practicing dermatology, she is also the medical director of dermatology in the Manhattan division of Northwell Health in New York City. Dr. Masse, thanks for joining us. Can you start by telling us what exactly red light therapy is?
So people say red light, but usually that means either red light, which is 630 to 700 nanometers, and that's very, very superficial. That just penetrates the top layers of skin. And then there's infrared light, which is a little bit different, but people still use it when they talk about red light. And that goes a little bit deeper. And that's when you think about the joint and the muscle benefits and sometimes even like nervous system benefits people are talking about. So a little bit different. And then I think one also feature that is important to note about red light therapy is it's something we call low level. And that means that it's not at the high level of energy that we use in some of these lasers, but it's low level. And so there's less heat produced and there's less kind of risk. So there is a better safety profile because of that.
What is it doing to the skin? What's it doing to our biology? Because it seems to me if I shine a red light on myself, I don't understand how it would do anything.
Absolutely. This is kind of like where the geek in me comes out. I'm so excited about the science behind it. So red light will shine on your cells. And if we think back to like our high school classes, everybody learned about the powerhouse of the cell, the mitochondria.
Oh, yeah.
You remember that?
Oh, yeah, definitely. Somebody's got to reverb that. The powerhouse of the cell. Like you just have to. It's great.
So that's the mitochondria for you. And the red light shines on the cell. It mostly targets this mitochondria. And then mitochondria produces energy, the energy currency of our cell, something we call ATP. And so that energy allows a cell to kind of go through its cell processes a little bit more efficiently and effectively.
Okay, so ATP is adenosine triphosphate, and it's the primary energy-carrying molecule used by all of our living cells to power all the basic biological functions.
Right. So kind of getting down to the nitty-gritty, and especially how it helps with all of these anti-inflammatory and skin processes, it does a few things. It kind of suppresses the pro-inflammatory cascade in our cells, so less inflammation. Releases something called nitric oxide, and that helps dilate our blood vessels. So that means more growth factors, more nutrients kind of coming to where we want them to be. And then it can also help turn on some genes to help stimulate fibroblasts, which are the cells in our body that help make collagen and elastin. And so that's where a lot of that anti-aging kind of hype comes from.
Whoa, that's really interesting. So the skin benefits seem like they could be any number of things. If it's opening blood vessels, if it's promoting like some of these collagen things. Are these supported by scientific evidence as well? I mean, we've got this long history of science in this area. Are all of these things supported? Should I be doing this?
That's a good question. So, you have the basic science, which we've kind of talked about, but then you also have clinical science, and we can go into kind of each indication. But I think one of the things about red light therapy in general is that, yes, we can apply it to all of these, or at least we think we can apply the benefits to all of these different facets. But the truth is we really have to look at each specific indication, and there has to be some kind of good study about each indication if we want to truly answer that question.
Okay, Dr. Masse, I wanted to get into some of those specific indications for red light therapy and the evidence that we currently have. But let's first talk about a different kind of light, ultraviolet light or UV. It's the light that the sun gives off. It can damage our skin. Too much exposure can cause sunburns and speed up signs of aging like wrinkles and age spots and increase your risk of skin cancer. And that is what happened to our guest, Mika. So, Dr. Masse, I'm going to play you a clip of some of my interview with Mika and get your thoughts on it after.
I have been an avid sun worshiper my whole life. I never thought about getting skin cancer. Since my melanoma diagnosis, it ended up being 9 days of having the size of a silver dollar cut out of my right cheek. And it took about 70 stitches to close up. I have a scar on my cheek that will most likely be there forever. And all for a very silly reason, all because I was a little misbehaved in the sun. My esthetician told me about red light, and she said it will also help your scar and it will help with just kind of building collagen and fine lines and wrinkles and all the things that you normally care about. The reason that I am more intently focused on red light than most people, or what I would have been if I wasn't diagnosed with melanoma, is because I have a giant scar on my face. I don't want them to be there forever, so I'm going to try this.
So, Dr. Masse, do you think that red light therapy is going to help with Mika's scarring?
You know what? I really wish I could see her scar because we tailor our approaches to scar treatment so much based on the type of scar, what it looks like, how long it's been there. She did say that she has these giant scars. It's going to help a little bit, hopefully, with kind of a commitment to doing this routinely and regularly. But I hope she's doing a little bit more than that, too.
Okay, let's keep going with some of the claims from our guests. Here's Rosa Hoffman, a content creator who posts regularly about red light therapy.
You can have some serums, like actually red light and green tea are known to work really well together. So if you have a green tea serum, or even if you just take a green tea and put it in a spray bottle, spray that on your body, that will also help.
So green tea, does that help enhance any of the red light therapy benefits? Is there evidence there?
I hate to say it, but I think this is probably one of those instances that's a little bit more getting ahead of ourselves than like anything to truly back it up. So what I think she's referring to is a study from 2009, but study in quotation marks, because I don't think you can actually call it a study. They basically took one patient and published a before and after photo, and there have been no studies since 2009. And so, we know that green tea can have its own benefits. It's a powerful antioxidant. It actually restricts blood flow, so good thing for things like redness, good for things like puffy under eyes. But to say that together somehow they magnify or amplify each other's effects, I just don't think that there's any data behind that. So maybe you can use them separately, you can use them together, but each just, I think, has some benefit, but not something that has to be coupled together.
Right. So it's not necessarily one's going to enhance the work of the other one. That makes total sense. Okay, let's play our next clip from Rosa.
I actually bought a red light device for my gums. I had gone to the dentist this one year, like way too many times. My gums were really inflamed. All the research I had done was really around how good it is for inflammation. So when I bought it and I tried it within, and I am not exaggerating, it was a very short time. I want to say a few weeks. My gums were almost healed to the point that when I saw my dentist, he was like, "What did you do?" I'm like, "This is what I use. I use this device." He's like, "Okay, keep doing it," because it worked. So at that point, I was super bought in that it does help with inflammation if you're consistent and you're doing it.
So what do you think of that clip? Does this help with inflammation?
So inflammation specifically, it's just hard to target because we want to talk about true indications rather than broad inflammation. And just because we see anti-inflammatory signals on a molecular level doesn't necessarily mean that will translate into kind of a clinical finding.
Yeah.
But in her case, I actually think that there's probably some truth to it. And the reason I say that is because one of the best studied indications for red light therapy, we put a lot of research into patients who are undergoing treatments for cancer patients. There's just a lot of funding for that, a lot of interest in that. And so we know that one of the biggest benefits of red light therapy that has been documented is for something called mucositis, which is severe inflammation of the mucosal lining of kind of your GI tract, mouth included. And so a lot of these kind of world-known cancer centers will actually have red light like treatments for people who have really inflamed mouths, oral mucositis, just to help them deal with some of the side effects of chemotherapy. So I do actually believe that there's probably a role for that. Most people don't use it for oral inflammation, but the data points to the fact that it probably does work.
Wow, that's amazing. So let's go back for a second and talk about the evidence for inflammation and how this can help with inflammation if it does.
So when we as dermatologists or physicians in general talk about inflammation, we can mean 20 or 30 different things, different pathways. Just generally speaking, yes, it's been shown that when cells are exposed to red light therapy, they produce less of these pro-inflammatory signals and more anti-inflammatory signals. But you have to think about, well, what does that mean clinically? Does that make any sort of difference? And I always say just because there's a little bit of an extra protein in a cell, that doesn't necessarily translate into it being a cure for psoriasis or arthritis or any of these inflammatory conditions. And so I think it just, once again, we have to focus more specifically on understanding studies for each specific indication rather than for something like inflammation broadly.
Yeah, that makes sense. We got another clip here. Let's listen to it, Dr. Masse, and see how this goes.
No matter what I did, lasers, creams, everything, the melasma kind of kept coming back. And so eventually I did have a laser that really did help to clear out a good chunk of that melasma, but it was definitely the red light therapy that helped keep that inflammation down. Because historically speaking, my melasma always came back, even in the summer. The moment I'm in the warmth or if I have a blow dryer on my hair, that heat would always activate it. And so because I've been so consistent with the red light, using my masks, doing my panels, I'm not seeing the melasma come back.
So firstly, let's define what melasma is for the people that don't know.
Melasma is a skin condition where you get these patchy hyperpigmentation, typically on your cheeks or sun-exposed areas, and notoriously very difficult to treat.
Yeah, and so do you think this is something where red light therapy could help treat or get rid of this melasma?
You know, I do find that really hard to believe. Like I said, melasma is so hard to treat, and there's just absolutely no evidence that this is better than any kind of classic or gold standard treatment. So if you're suffering from melasma, I would 100% all day, every day recommend seeing a dermatologist, talking about your topical, oral, and laser treatment options. Yeah, I'll leave it at that.
Yeah. Okay, let's play our next clip from Rosa.
I always see like a glowier, plumpier skin when I do red light. I've been doing it for so long that I actually have to look back at photos from before using red light, and you look different. I feel more vibrant. I just feel more plumpy. My skin looks more alive, where I feel like it was duller in the past.
This is something you hear a lot, right? People look at pictures of themselves or they feel their faces has changed in some ways. How strong is the evidence behind this kind of claim that the skin has got more collagen production? It looks plumpy. It looks, nice.
Yeah. If we look at the studies, you definitely see some benefit. So we talked about how it can turn on these genes in your cell, which is pretty cool. It really turns on genes that make more collagen, that stimulate these fibroblasts to make more collagen. Then you look at clinical studies, and we talked a little bit about it before, but they'll literally clinical studies, they can use like an ultrasound, for example, to measure the density of your collagen. And then this profilometry, where they literally go and measure the depth of your wrinkles, that helps quantify those changes in collagen. So we definitely have the data there. What's harder to gauge is scientifically measured changes enough to see like a clinical change when you're actually looking in the mirror. There aren't a lot of studies on that. And I will say, just from seeing a lot of patients on this, it kind of spans the gamut. So you have patients who definitely feel the same way Rosa feels, where there's definitely a difference. And then you have patients who are kind of upset and say, I've been using this for so long and I see no difference. And so the truth is there is a difference on a microscopic level, but not everybody will feel that there's a clinical difference as well.
So Rosa's experience with her skin, that could be from red light therapy. It could be from some other part of her routine. It's hard to say without a lot more research.
Yeah, exactly. And, I do think that there's a benefit for sure, but it also might be not only because of the red light. We don't know what else she's using. I'm not saying that there isn't a benefit. There for sure is.
Yeah. Here's another clip from Rosa.
And red light therapy is more than just skincare. To me, it's part of my healthcare. It's a healthcare stack. So it's about my inflammation. It's about my muscle recovery. It's about relaxing my nervous system. That's so important to me too. And it also does help with my skincare. So I feel like red light just does a bit more because it's hitting more issues than just a skincare device. Like red light is always a stacked protocol in my wellness journey. So whether I'm working out on a vibration plate, my red light is on. I could be sitting in my sauna, my red light is on. I could be giving myself a little laser and my red light is on. So I can stack that. And that's also the part about red light that's great is you can use red light in any scenario.
So, Dr. Masse, what is your reaction to that?
I think we need to bring in like a physiatrist and neurologist to get to the bottom of some of those claims, in all seriousness. I think there is some evolving, promising data in those fields as well. And it's really pretty neat to think about, like, there's this one treatment modality that can kind of help all of these things. I guess my reaction is I do imagine that Rosa is using different wavelengths and hopefully different machines to target these different concerns, because I don't want anybody to leave this podcast thinking that, your standard red light mask is going to have any effect on your nervous system or your joint inflammation, because it does not penetrate anywhere near to those depths. You're really looking at the infrared wavelength in that sense.
Yeah, that makes sense. And I think that's something that people want it to do necessarily, right? We're looking for those benefits. Whether the science supports it, have to wait and see when they do more research. We have another clip from Sly Huncho. He's a barber, has a huge online following, and he talks about red light therapy as well. And he's talking about his mask here, and it has different colors of light, not just red.
So I clicked the button, but it changed colors. I'm like, Then I clicked it again and changed the colors. And then I looked at the manual. It's like, it got red light, blue light, and then you could do both at the same time. So I was like, oh, snap. I like to turn both of them on because one of them is for wrinkles, and then the other one's for like blemishes.
I'm glad that he brought this up because I was curious about this too. Our little mask that we got to explore this has like purple and it has blue. It does all sorts of things. I look like fireworks when I'm wearing it. So what are the differences? Are there differences and how do they work?
Yeah, I really like that some masks are incorporating both red light and blue light. Blue light has a much shorter wavelength and even more superficial, incredibly superficial in how it penetrates. So it really just targets your epidermis, that topmost layer of skin. And it targets something different. It doesn't target the mitochondria, it targets porphyrins. And those are molecules that are made by the bacteria that cause acne on our skin. And so when blue light hits those porphyrins, it makes something called reactive oxygen species. And those are toxic to the bacteria on our skin. And so there's less bacteria, then there's less acne. And so blue light is predominantly, whereas you have a lot of indications for red light, blue light is predominantly right now being used for acne-specific treatment. And so because they work differently, when you combine them for something like acne, you're probably going to get better results.
That's fascinating. So red light penetrates a little bit deeper, blue light stays a little bit more surface level, and it's mostly used for acne?
Right. So red lights, I don't want anybody getting the idea that red light, true red light, 630 to 700 nanometers really penetrates deeply, but yes, deeper than blue light. And so they're working a little bit differently.
Does red light also help with acne?
Absolutely can help with acne. There have been, I think at this point, so many studies. They are smaller studies, and so you can't kind of draw as much of a conclusion from smaller studies than you can have in studies that are looking at hundreds or thousands of people. And there are some really cool studies that actually take people and expose half of their face to red light and then don't do anything to the other half of the face. And that's the best comparison because it's the same person that they're looking at. And kind of across the board, all of those studies show that there's less of an acne bump count, lesion count, when you compare it to the side of the face that's been exposed versus that hasn't been exposed. So that's pretty cool. You can't really argue with that. But then, it does become a question of we can see the bumps, but how do patients perceive that? And luckily, in the sense of acne, most people will say, yes, I do feel an improvement since using my acne mask. But at the same time, it's not 100%. It's not the same results that people typically get from medicine, for example. But there's certainly a benefit, and we can't argue with that.
Got it. What about rosacea?
Rosacea, I think less so, to be honest. So there just aren't as many studies, first of all. But secondly, I think when people think of rosacea, a lot of people think of redness, and they assume that redness is so hard to target. And we're the first to admit that as dermatologists. It's so hard to target. And so you're not really doing anything that is targeting that specific concern with the red light. So maybe you'll get a few of the bumps from rosacea, similarly to acne, that are decreased. But that primary concern that seems to be redness for a lot of patients, that typically probably isn't going to be really effective.
Yeah, when you say it's hard to target, you mean it's hard to find out exactly what might be causing it for that person? Is that what you mean?
No, I guess more so I mean, we know that it's dilation of blood vessels. And here with the mask, we're saying actually it can dilate blood vessels even more. So that doesn't, that's not really helpful here. For something like that, you really do need a true laser that can target those blood vessels a little bit more effectively. The mechanism just doesn't align.
Yeah. And so what about eczema or other inflammatory kind of problems?
Yeah. With eczema, I don't think that there are a lot of great studies. They have very few patients and they just don't have great quality behind them. To be fair, though, that is probably because we have so many other tools in our toolbox as dermatologists that work so much better for eczema that I don't think that that's getting investigated probably as some of the other indications. But from the few studies that are out there, they tend to be less impressive than kind of the acne studies.
So a lot of influencers suggest that red light therapy can improve wrinkles, can improve hair growth. Let's talk through some of these and see which ones have some science to support it. So first, the one you hear about a lot, the one that I've thought about getting one for, is wrinkles. I'm in my 40s now, starting to think about it. Does it help for that?
Yeah, we definitely have evidence that it does. So once again, we always want to think about the basic science, like does it mechanistically make sense? And then we also want to talk about the clinical evidence, like are people actually seeing a difference? So we mentioned fibroblasts before, these cells that produce collagen and elastin. So it's really cool because red light therapy has actually been shown to turn on specific genes that kind of increase the production of these fibroblasts and thereby production of collagen. And so that's kind of what's responsible for making our skin look plump, smooth, youthful. If you think about it clinically, wrinkle improvement can be very hard to measure. I mean, if you go to somebody and say, well, do you find that you improved, your skin texture, your wrinkles improved? People are like, I don't know, you tell me. It's very hard. So some of these studies, and once again, they're such small studies, but they have used really nifty tools such as profilometry, where they have found a difference, or elastometry, where they go and measure the amount of elastin. And so these small, understandably small studies, they do seem to show that there is true benefit.
Yeah. Cool. Well, I just picture them like stretching my face. Like, yeah, this seems stretchier than last time you were here. What about for hair growth?
That, I would say, has even stronger evidence behind it. And that might just be because more studies have been done, more either for whatever reason, more funding or more interest in, the people are researching these things. We have really good data, but I just also want to say we have really good data for specifically androgenetic alopecia, which is a specific type of hair loss. So I think a misconception is that it's great for all types of hair loss, and we just don't have that data. So we have data for androgenetic, which is female or male pattern hair loss. It shifts your hair from the kind of static phase or the shedding phase to the growth phase, or what we call the anagen phase. So more hairs entering that growth phase and growing. And then also it dilates blood vessels. So you're just getting, people often do like scalp massage, which actually has some benefit too. But the more nutrients and the more growth factors you can get to the hair, the more helpful it'll be. And then clinically, when we kind of look under a microscope, these studies pretty consistently have shown that there is one, more hair, and two, that the diameter of the hair is actually greater. But what is interesting, though, is that also at the end, most of these studies will ask patients, well, did you see a difference? Typically, there is a difference, but it's much more modest than the scientific differences. So what that means is that while on a microscopic level, we might be seeing really impressive differences, those differences might not be kind of clinically as apparent. Not everybody will see a difference in the mirror.
Interesting. How often would somebody need to do this kind of therapy? So is this something I would do every day? Is it something I do every week?
Most products will recommend doing it a few times a week.
A few times a week. Okay. So that seems doable for sure.
One of the most important things that we're realizing with red light therapy is the frequency at which people are using it. So if you're more likely to be able to be consistent with it at home because you can do it at home and not have to go anywhere, then it makes sense to do it at home because you're going to have better results because of the consistency.
Okay, that makes a lot of sense. The success of red light therapy depends on how much time and how often you can use it. Actually, Sly had something similar to say about this.
Stay consistent just so you can actually see the results that you want. Because if you try it for one day, it's going to be like, oh, it don't work. Or if you try it for like a week, oh, it don't work. Of course, it's not going to work in 7 days. You got to do something 100 times just to see if it works. So try it 100 times. And then if it don't work or you don't see results, then you can say it don't work. So my message would be to stay consistent with whatever red light therapy or mask that you use.
This sounds like good advice to me, but it does make me wonder about the risk of using red light therapy. Is it something that's safe for everybody universally, or are there situations where people should avoid it?
That's a great question. One of the things that we love about it is its great safety profile. So overall, it's very safe, and probably like the most common side effects we see are a little bit of temporary redness or maybe a little bit of mild temporary skin pain. But I do want to say that one population that really should be a little bit more cautious about it are skin of color patients. And we know that they are at higher risk when using these masks specifically of redness that persists, permanent discoloration, or even blistering. And that doesn't happen often, but we do see it much more often on a relative basis in that population. And so I would say if you are skin of color, I would recommend just starting at a lower power, starting with lower, shorter treatment times, and then kind of working up as you can tolerate slowly.
Yeah, to see how your skin reacts to it.
Mm-hmm.
That term, skin of color, is commonly used in medical and cosmetic circles to identify people who have naturally pigmented skin, from olive skin tones to brown and black skin tones. It's important to acknowledge that people with deeper skin tones may have to modify their treatment.
Exactly. And then one other question I feel like I get all the time, maybe it's because of my age group, but people always want to know, is it safe in pregnancy? I feel like so many things are off limits in pregnancy because we just don't want to take the risk. Unfortunately, we don't have a lot of data behind it. And I think most dermatologists, myself included, because of that, take a more conservative approach. Better to hold off.
We've talked about how it works, right? Let's kind of pivot to what are some of the bigger misconceptions of these?
I feel like with all of these influencers now talking about these rave reviews, I think for me, the biggest misconception is that we've suddenly all of a sudden stumbled upon this magically guarded secret and now it's going to change your life forever. And that is just at the end of the day not true.
Yeah.
You really have to understand that these are meant to be an adjunct treatment to other things that you're doing. So a little bit extreme, but the example I always give is probably at least a few times a month, I'll have an acne patient come into my clinic and they'll say, I don't wash my face consistently twice a day, every day, but should I get this mask? And I just want to say, well, please, let's commit to washing your face first. Like, I promise you that will give you better results than a red light therapy mask. I think in this day and age, we're just all hoping for like that quick healthcare hack. You're going to get the best results if you're coupling that with kind of a multifaceted approach. So I always try to frame it as it would be a good adjunct therapy rather than a monotherapy. You can't compare it directly to any of the other products out there because it's not meant to replace them. It's not meant to do what those other products do. It's meant to work kind of in tandem with them. Is there a role for it as somebody's broader skincare routine? Absolutely. It's incredibly convenient, has a great safety profile. It would be silly kind of not to utilize that. There are definitely some proven benefits, but at the same time, it just shouldn't be the only thing that you're doing.
What should a consumer look for when they're evaluating one of these devices?
That's a great question because it certainly can seem like the market is endless out there. Every company's trying to jump on that bandwagon and sell their products. So first and foremost, I think you have to know specifically what you want to target. All these indications have different wavelengths. And so you want to find, one that either works for acne or skin rejuvenation or something not related to skin at all. And so you really have to understand kind of what you're trying to solve for. Past that, you want to look at something called irradiance. Irradiance, we think, is the measure of efficacy. So on a box, you'll see that listed as milliwatts per centimeter squared. That's how much power is actually reaching your skin. So some of these products will just have total LED wattage, and that's not really going to give you much information. So you really want to look at the specific irradiance, and typically, generally speaking, higher irradiance means better efficacy.
We're talking nanometers, we're talking milliwatts, we're talking centimeters. That might be a bit complicated sounding, but irradiance is the amount of power the red light mask is shining on each square centimeter of skin, right? More milliwatts of power, maybe the mask is working a bit better?
Exactly. Past that, I would say, I know this sounds silly, but reviews. So you want something that a lot of people have used, that people have had good results from, and that are very transparent about all of their specifications. Also bonus points if something's FDA cleared, because that means it's been around for a little bit of time and has had a little bit more of investigation into it.
Yeah. Most people are reading the reviews of these and they're seeing like, okay, well, this worked for me, this worked for me. I mean, you mentioned a very specific set of wavelengths. Is there like reddish light that's outside of that someone might still buy a mask and that's why it's not working? I don't know. It's kind of a strange question, but...
I think, for a lot of, and this is, I guess, where dermatologists come in, but for a lot of these indications, even in that broader wavelength category, there have been protocols that have been described that narrow down on, well, this is maybe the better wavelength for this specific condition. And so that's where your dermatologist can come in to be a little bit more helpful because it's not just this whole spectrum of light.
So, Dr. Masse, as a dermatologist, where would you rank red light therapy among all the different kind of interventions that are available in anti-aging and skin health? Where would you put it?
This might come as a surprise because I feel like we've talked about how there are so many studies that have shown benefits and it's convenient and it's wonderful in so many ways. But at the same time, I do still think that it kind of ranks on the lower end for me. There are just a lot of other modalities that have much stronger data behind them. So if we're talking about the very basics, like any day, every day, I will always recommend sunscreen, a good moisturizer, and a retinoid over red light therapy. So I feel like if you're not doing that, there's kind of no point in even talking about a red light mask. You think about, well, after that, what gives me the most drastic results? And so I'm much more likely in patients who have specific concerns, who have cosmetic concerns, or just want their skin to feel better. I'm much more likely to reach for things like microneedling or chemical peels, neurotoxins, or resurfacing lasers. But that doesn't mean that there isn't a place on the market for these. It just means that even though there is some data, we still have other tools that just have so much better data for them right now.
Yeah.
But at the same time, I will say, you also walk down the pharmacy and see like piles and piles of over-the-counter creams that probably have zero data behind them. So definitely ranks above any of those.
You know what? That's actually very clear, I think, on some level. That makes me feel better. Because at first I thought, I should get one of these. And I'm like, but I'm not really doing a lot of these other attempts, which I think is important. Red light therapy isn't the miracle cure you might see on social media, but it's not just hype either. For some conditions, particularly certain skin disorders, there's promising evidence that red light therapy can help when it's used correctly. For many of the broader claims about pain, recovery, and overall wellness, the science is still catching up. As with so many health trends, the biggest takeaway isn't whether red light therapy works, it's what it works for, who it works for, and how much of the internet's enthusiasm is actually supported by research. So if you're thinking about adding red light therapy to your routine, make sure to keep chasing the evidence, not just the glow. And don't forget to check in with your physician before making changes to your healthcare routine. Have we shown you the light? Be sure to let us know down in the comments. Thanks again to Dr. Margareta Masse for sharing her expertise with us. And thanks to Sly Huncho, Rosa Hoffman, and Mika Stambaugh for sharing their stories and experiences with us too. We did it again. That makes 8 online health and wellness trends that we got to the bottom of. Don't worry though, we still have many more trends to cover when Health vs. Hype returns for another season. So subscribe or follow now if you haven't already, and join us next time on Health vs. Hype with the American Medical Association. For more information on all the topics we're covering, visit amahealthversushype.org. That's amahealthvshype.org. Health vs. Hype is a production of Ruby Studio from iHeartMedia and the American Medical Association. I'm Trace Dominguez. Our producers are Matt Stillo and Pamela Lawrence. Michael DePoe Wilson is our writer. The show is engineered and features original music by Matthew Ernest Filler. Health vs. Hype is intended for educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment. Always seek the advice of your physician with any questions you may have regarding a medical condition.